Okay, I think we'll get started right almost on the clock here. I just want to say welcome to everybody that's here today. Thank you for taking the time out of your day to join us. This program, Welfare During Disasters, is being put on by WPV-CERT and WPV Ready. My name is Selena Brown, and I am the Public Education Officer and Emergency Preparedness Coordinator for Woodside Fire Protection District. I'm here just to introduce or to open it up to everybody. Just want to shout out to Vicki Coe for obtaining our amazing guest speakers that we have today, and I'm going to let them introduce themselves. But I just want to let you guys know that after each speaker, we're going to allow some time for Q&A. So as we go along, if you have a question, please put it in the Q&A box down at the bottom of your screen. I think the chat box is open as well, but we really would appreciate if you put your questions in the Q&A box. And then if there's any questions that we don't get to, we will we'll get back to them at a later date. And also be aware that we will be recording this session. So after the fact, if you maybe had to leave early, or if you know some people that wanted to attend that couldn't, this will be available on both our YouTube channels for WPV-CERT and WPV Ready. So please share. With that, I will hand it off to Abby.
Hi there, I'm Abby Kaufman. I'm an internal medicine specialist at SAGE in Redwood City. And I just have a few disclaimers. I am not functioning as a representative of SAGE during this presentation. And also, this is just a brief discussion of first aid and animal restraint, and obviously not sufficient to create expertise. I'd also like to thank my colleague, Colleen McCoy, for letting me use some of her slides today. So I'll get started. I have a lot to cover. The one thing I will say, it's not just in disasters. I was hoping just to give everybody some idea of just general care for your pet in emergency situations. Sorry, I'm having trouble advancing this. Whoops, sorry. Okay, there we go. Okay, so what I do, we go camping a lot, so I definitely have a first aid kit for our pets, and I would recommend everybody have one, both for disasters, but also just for any situation, so you know where all your animals' supplies are that you may need. Excuse me. The other thing I have in my first aid kit is a battery operated clipper to be able to clip hair. You can use a scissors, but they can be dangerous. So I would be careful about that. So some other things that I think are important is for everybody just to kind of get to know what's normal for your pet. So I have some parameters here so that you'll be able to know when things are outside the normal range. So dogs and cats' temperatures are higher than people, so don't get alarmed if they're at 100 to 102.5. And certainly dogs, after exercising, they can get up to 103, 104. But these are just some normals that you should get accustomed to. Some other things that I think are important is just to know how to get your animal's vital signs so that if you needed to do this in an emergency, you're not concerned if there's on how to do it. So you can do this with a dog or a cat. You feel for their heartbeat kind of right behind their front legs, and then also feel their pulses in their hind legs on their femoral artery. In a small dog or a cat, you have to be a little careful because if you apply too much pressure, you can occlude the vessel and not feel the pulse and think that there's something wrong. So again, I would recommend just doing this as something to familiarize yourself with your pet and how to get their vitals. As far as some just basic things, as far as respiratory rate, you count both inhalation and exhalation as 1 and count for 30 seconds and obviously multiply by 2 to get breaths per minute. You should, with a dog, you should certainly take it when they're at rest and not panting. Vital signs that are cause for concern: if your animal's temperature is less than 97 or greater than 104, heart rate for a dog less than 40, unless they're a very fit animal. Sometimes it can be in the 30s when they're sleeping or resting. And again, cats, anything less than 80 or excuse me, higher than 220. So other important things, you should certainly know your animal's medical history, so that if they have any concurrent diseases, you'd be able to alert somebody once you eventually take them to a veterinarian. And the other thing that's really important is wherever you are, whether you're here in this area or traveling, that you know where to take your pet in the event of an emergency. And I know that if there's a disaster, it can be hard to get to a veterinary clinic. The one thing that I think is great about where we live on the peninsula is there are multiple facilities that are open 24 hours a day. We have Adobe, we have Sage Redwood City where I work, and then there's also North Peninsula, and there are a few other clinics that are also have extended hours. At least at Sage, I know we have generators, so in the event of an emergency, we can be pretty much up and running in all situations. And I think some of the other hospitals do also. So you have lots of places to go should one be closed, if you need to get someplace and you can't handle the emergency yourself. Other things that you should know is don't give your animal over-the-counter medications without consulting a veterinarian. So you should be kind of familiar with some of these. A good example is Advil should never be given to dogs. There are, doggy equivalents of Advil that are okay, but don't ever just give them something over the counter. And again, don't believe everything you read on the internet. Again, just some basic things is learn your animal, but in an emergency situation, just scan the whole body, look for wounds or if there are hives or swelling. The other thing is dogs in particular, if they have a wound, they may be licking the area, so you may just feel wet fur. And if that's the case, you should interrogate that area pretty thoroughly to look for a wound. The other important thing to remember is even with your own pet, if they're injured or frightened, they may harm you, not intentionally. So it's always a good idea, if your animal's injured, your dog, to put a muzzle on them. I think having a slip lead in your emergency bag is a good idea, because in this case, I show you how to apply a muzzle, which is a good thing. As far as cats can be very dangerous when they're injured because they have both a mouth that can bite you and 4 legs. And when they get scared, they can do alligator rolls. So what I think is a good thing to do with your cat is to wrap it in a blanket and then put it in a carrier. Not that you don't want to examine it, but I can't tell you how many times I've seen people, while bringing their animal in after it's been injured, be really badly injured by a cat or a dog, and they themselves have to go to the hospital. And you do not want this to happen, especially if we're in the middle of a natural disaster. Cats, if you keep them in the carrier, just let them rest. And also it prevents them from running someplace and hiding, and you have them available to take in to be cared for. So just remember, you don't want to get hurt because it makes the situation worse. As far as lifting your dog, the best way to do it is to put your arm, like is shown here, in front of the animal and then behind, so that you're not pushing on any particular part of the body. If your dog's too heavy for you to lift on your own, one of you can take the front end and then the other the back end. As far as just restraining a dog, as you can see in this picture, what you want to do is you want to have control of the head in case it's not muzzled and it tries to bite. In this situation, the woman's left arm is around the head and can hold the animal, and then holding the body or the leg that's close to them. When you lay your animal down, let's say you want to bandage one of the upper legs, you want to hold the 2 lower legs that are down on the ground so the animal can't jump up and it stays on the ground, and one arm, is on the upper leg to keep the body on the ground. Some common injuries that happen are that animals can have injuries to the paw or the back of the leg here, where there are tendons and vessels. The important thing to remember is that this area is under stress. And so when this vessel, if it gets injured, it will retract up away from where the site of the injury is. So if you're going to apply a bandage, you want to make sure that you apply pressure not only to where the laceration is, but up here to help stop the bleeding where the vessel has retracted to. You want to rinse it with water and apply a non-stick gauze. And I'll go over bandaging in a little bit. So what you want to do cleaning a limb before putting a bandage on, in this case, the animal's paw is injured, so you can take a plastic bag and either fill it with water or saline. You can use some very mild soap and create like a jacuzzi action by pushing your hand on the bag. The other thing is if you have saline spray in your medical bag, you can just use pressure to irrigate this and remove any debris. Any temperature is okay. If it's warm water, sometimes it's more palatable to the animal. As far as skin wounds, what you want to do is definitely dog or cat, try and prevent them from licking it because they can make the situation worse, especially a cat tongue is very abrasive and could make something like this worse, but also with infections. You want to clean it well and try and cover it and keep it moist because something like this at some point may require sutures and you don't want a lot of dead and dry tissue. So if you can keep it moist, it's helpful. And again, if you could cut the hair around here, you can try using a scissors, but be careful you don't cut the skin. Or if you have a clippers, you can clip the hair and then rinse the hair out with the saline spray. Punctures are bad because they're deep and risk infection. And also you may not be able to see them. They can be hidden by hair. So animals often, if they have a puncture wound, they will lick it and you can feel the wet hair and that can give you a clue where it is. You want to, with these deep wounds, you want to flush them as well as possible. And again, that's where a saline spray, or even if you used contact lens saline solution, you can generate pretty good pressure to wash something like this out. Common injuries to the skin. This is a laceration that goes through all layers of the skin. And what you're looking at here is muscle. So before going to a veterinarian to have this sutured, what you want to do is clean this really well. If possible, you want to keep it moist, either with something like KY or some type of lubricant, or even use some type of gauze and put saline on it to keep it moist. And then you can apply a bandage around the whole animal to keep it in place. So as far as bandaging, what's the purpose of a bandage? Well, it's to cover the wound. You want to apply gentle pressure to help control bleeding and apply support if needed. And sometimes we'll use it in combination with a splint. So the one thing that's really important about bandaging limbs is that if you apply them improperly, you can have a big problem. You can see this foot. It was the bandage was applied too tightly and cut off the circulation, and there's devitalized skin. And in some cases, animals have lost toes. So you got to be really careful applying a bandage. And I'm going to go over this with you. So basic supplies that you'll need. You want to have, there's generally 3 to 4 layers. You want to have something that you can cover the wound with. So a Telfa pad, or you could use gauze that you put some sterile saline on to keep it moist. Then the second layer, which is really important, is padding to provide support. And you can use something like cast padding. You can get cotton roll gauze. In a pinch, you can use a thick, clean sock as long as it goes over the whole area that you're bandaging. Then you want to have gauze to compress the underlayer, and then an outer layer, something like vet wrap, Coflex, or an ACE bandage. So again, these are things that you'll need. You could have Telfa pads or just some gauze pads. This is cast padding. Again, you could use roll gauze, roll cotton, or as I said, a sock. This is the gauze that goes outside that, and then vet wrap. And we'll go through all the little layers that you would apply. So you apply the Telfa over the wound that's here. Then you take the cast padding and make a number of different layers. Always start from the toe and work up. And apply multiple layers so that you have a nice cushion in a uniform fashion. Then outside that, again, you start with the toe and you use the layer of cling gauze, rolling it up from the toe. You want to make it secure, but not too tight. Again, go all the way up to the top. And then when you apply the outer layer, excuse me, of the vet wrap, what I usually do, because this you can make vet wrap pretty tight, is I unroll a little bit, like shown here, then you put that around, and then keep going up the leg until you get to the top, using mild tension. You want to make sure again that it goes all the way to the toes, because if you leave the toes out, then you could cut off the circulation to the toes. Again, I can't emphasize this enough. Remember, bandages can be dangerous. They can cut off circulation. If the bandage gets wet, it can increase the risk of infection. And if you bandage too tightly around the chest or abdomen, it can make the animal have trouble breathing. And if you put a splint on, it can increase discomfort if you put it on incorrectly. Splints are used in association with a bandage if the limb is unstable, if you have a broken bone. But just remember, you can't use a splint if it's on the upper arm or the upper part of the leg, because you can't really immobilize above the break. And so in a case like that, you certainly could put a bandage on, but a splint, if it's not fully immobilized, could make it more painful or dangerous. If you needed a splint and don't have one, you can make it from tent poles, branches, blankets, just something more firm. So some other things that I'd like to just talk about. Hyperthermia certainly can happen if it's too hot. But the other thing why I wanted to bring this up is sometimes animals, when they're injured or agitated or scared, certain breeds that are predisposed to overheating can get secondary problems and overheat and get heat stroke. And so animals that are at risk for this are the brachycephalic breeds, like we see here, the ones with the pushed-in faces, because the back of their airway is smaller and narrower, plus they have a lot of extra tissue. Some older dogs can be prone to overheating because their airway doesn't open well anymore, or if they're overweight and they can't dissipate heat. And so what can happen when these dogs get upset is they start panting, breathing hard because they get hot and they want to cool off. And the harder they breathe, they create turbulence. And then that turbulence of air can cause swelling in the back of the airway. And so then they can't get enough air to cool off. So it's really important to make sure that animals like this are kept calm and that there's good ventilation, because this can happen even when it's not very hot out. They just get themselves all worked up. So things that could let you know that there's a problem besides taking their temperature is that they're panting, agitated, their heart rate goes up. If they're walking around, they're not obeying commands because they're just getting frantic. Sometimes they can have vomiting and diarrhea, and other things more serious like brown urine. If an animal's temperature gets above 105, then that's certainly concerning and you need to take measures to cool them off. Hyperthermia, if it goes on for a long time, can lead to life-threatening complications. So we definitely want to avoid that. So things that you can do is you can wet the animal down, but you need to go all the way to the skin. If you happen to have power and access to a fan, that's helpful. Let them drink a little water, keep them in a cool place. Hypothermia can also cause problems. Again, in this area, we're probably not going to have issues, but mostly in situations like that, you want to just gently and slowly rewarm the animal. So other things that can happen, trauma. We can have trauma, blunt force trauma from falling or being hit by a car, or a penetrating wound. Head trauma is obviously very serious. Things that could let you know that the animal has head trauma is that they're mentally dull. Obviously, seizures would be very serious, abnormal behavior, unequal pupils. In the short term, before you can take them to a veterinarian, because this can be very serious, is to keep them calm and elevate their head about 30 degrees. But don't ever put any compression on the neck, and don't put an ice pack or a cold pack on the head. Other things, chest trauma can result in bruising in the lungs or air leakage from the lungs to the outside of the chest. Obviously, this can cause difficulty breathing. This is an X-ray of a dog whose head is up in this direction. This is the dog's heart. These are the lungs. So in a normal animal, the heart would sit right here on the chest, on the sternum here, the bones. In this case, this dog has kind of a double whammy. It has air outside of its lungs, which has raised the heart up. And you can see this here. This is called pneumothorax. And then here, this dog also has lung contusions. Up here, this should be kind of a black gray color, and it's all white because there's fluid, blood. So this dog is having trouble breathing because it can't expand its lungs because of air. And also it has chest trauma and the lungs are just not healthy. So in a case like this, you certainly would want to seek veterinary attention, but in the short term, you want to keep this animal calm and relaxed and don't stress it because it has very little reserve capacity to breathe. Abdominal trauma can occur just from blunt force, and the serious things, it can result in rupture of an organ. The most common things to rupture would be the spleen or also the urinary bladder. Signs that may let you know something like that's happening is sometimes you can see bruising of the abdominal wall. The abdomen can be distended. If it's bleeding, the animal could get weak. It's painful, and obviously shock and collapse are serious. So again, in a situation like this, you would need to seek veterinary attention, but you want to keep the animal calm and relaxed so that their blood pressure doesn't go up, they don't bleed more, and then take them where they need to go. So the other thing that can happen is animals can be impaled by sticks or other things. Interestingly, we had a dog come in the other day that had a stick that he had impaled himself at a dog park. And I was so proud of this owner that they did not remove the stick and brought it in because the stick went into the chest cavity. So you never want to remove an object if you can avoid it, because it can be in the abdominal cavity or the chest cavity. And if you move it, you could cause bleeding or allow air to leak into the chest cavity, which could be serious. So this picture here is just trying to show if this was the object that impaled the animal, you want to try and do something to keep the impaled object from moving so that it doesn't cause more trauma. So if you can create some type of bandage to keep it in place, that's the best thing. And then obviously you have to see a veterinarian, but I would, definitely remind everybody, even though your instinct may be if you see something sticking out of your pet, do not try and remove it if it potentially goes into a body cavity. That could be very dangerous. Other signs, severe bleeding if your animal is injured. Things that are would indicate severe bleeding is obviously spurting or pulsing. That could mean that an artery's been severed, or blood that just keeps pooling. That usually means a large vein. But what you want to do is apply pressure for at least 15 to 20 minutes. The other thing with a bandage or just over the area. The other thing just to remember is do not use a tourniquet unless it's in a life-saving situation, because you can cause damage to the other tissue. So again, just apply steady, firm pressure. So I know that was kind of a whirlwind of various things, but if you want more information, the American Red Cross Pet First Aid has a great website that you can look into and is very helpful. So with that, I will turn it over to either questions or to our next presenter.
Thank you so much. I think we have one question that says, how do you check for circulation after applying a wrap?
You mean if you're talking about the foot, what you would want to do, I don't know if you remember that picture where you could see the toes. The toes should remain pink. You can roll it back and look at the toes. They should remain pink and they shouldn't be too squished together. So that's a good way to test if that's what the question was asking.
I believe it was pertaining to that photo. Does anybody else have any questions? I think that was a lot of really great information. Okay, awesome. Thank you so much. We appreciate you joining us today.
Okay, thank you.
So our next guest speaker is going to be Jen Dalmasso. So I'll let her introduce herself.
Okay. And I have unmuted myself, yes. Okay. Hi, I'm Jen Dalmasso, and I am the lead shelter veterinarian at the Humane Society Silicon Valley. We are located in Milpitas, and behind us there in that photo is Mission Peak. Last summer, we were on order, but not full evacuation orders as the SCU fire crept around and down Calaveras Boulevard. So what we're going to talk about today is small animal sheltering and wildland fires, what that means, kind of how it's done, and a little bit about it. We've had some experience as an organization helping out in these situations. And the role of HSSV in disaster response, we currently provide animal sheltering for shelters that need space and medical support. We have a robust, I would say quite robust, disaster preparedness program that involves the entire shelter, that we have SOPs in place, practice runs, and various training to help us keep us up and prepared for the next thing that comes. We do have generators as well, and trailers, and a water pig, they call them. We have helped other shelters by bringing animals from their shelter to our shelter to help make space for urgent evacuees. It was found out with Hurricane Katrina that animals were taken into shelters and moved off site or out of town quickly, and it made it difficult for owners to come find their animals and reclaim them. So learn from that, and the animals that we take from other shelters are ones that they've had in the shelter for a period of time, and it makes room for animals coming in during the disaster. We've also provided support on the ground for the local communities. We have sent medical teams up, and I have some photos and things like that to help with both diagnostics of animals coming in that need treatment, as well as maintaining treatment protocols and treating the animals that are in the shelter. And then husbandry and enrichment, what it takes to feed and clean and take care of the animals, both physically as well as their welfare. Enrichment, getting them out and walking and really helping them along that way. So this was an example of an emergency transport. On the left, we went up to Sonoma County with the glass fire last year and helped by taking some of the animals that they had off their adoption floor and made space for people that were leaving the scene of the fire. We also medically are able to provide for sick, injured, and vulnerable. This, the photo on the right of the mom and pups, she gave birth after arriving at the shelter. And then a kitty there with an upper respiratory, not an uncommon thing that we see. And before I go too much in, the ASPCA has written the book basically on how to set up temporary animal shelters in both various disaster settings, as well as confiscates and cruelty cases. I'm going to touch just a little bit on the temporary shelter in a disaster setting, but the link down there, certainly the resources are almost endless, the webinars, the training that's available. And setting up a temporary shelter, 3 big questions. Where should the shelter be set up? Ideally at a warehouse or something along those lines that's large, contained, has electricity and running water, and can be easily cleaned. Fairgrounds are another great place to set things up. And there's photos, it's already set up for livestock, so it's a natural place for evacuees to take their livestock and large animals. Tents are an addition. They can be an alternative, but they're usually an addition to something that you already have if you need additional space. Other things that we want to look into when you're trying to determine where to set up your temporary shelter is proximity to resources. Are there enough things around the shelter that you can get the supplies that you need? Is there housing available for people that are there helping run the shelter? Pet supplies, grocery stores, and transportation. Is it close enough to highways, airports in some cases as well too, so you can continue with the appropriate supply chain to provide what you need to keep the shelter running. And then especially in the disasters, is it far enough away from the disaster site to be safe? And who should be involved? Who do we want at this shelter? We need veterinary medical personnel, people that are trained to help with animals. Veterinarians, the registered veterinary technicians and assistants are all super helpful. If you have someone that is experienced in dealing with large numbers of animals at any given time, a shelter veterinarian or shelter veterinary staff, that is certainly helpful when you're running a large shelter. Individual medicine is also very important because you have individual animals coming in with individual needs, fire victims, trauma victims. So it's a combination of the two. Ideally, you need people there that are able to handle animals, can get dogs in and out of cages, know the shelter operations protocols, feeding, cleaning, how to do all of that on a large scale. One of the shelters, and we'll show some photos of that coming up, we had up to 500 animals on site at one time. So there was a lot of moving pieces and a lot of people working to take care of them. And then you also having animal behavior personnel, people that can come in and help provide the enrichment that the dogs and cats need and maintain their behavioral health. Being in a sheltering it's more than putting them in a crate, feeding and cleaning twice a day. In order to maintain their mental health, we need to be certain that they're getting the enrichment that they need, that we try to provide as low stress handling as possible. Shelters are scary places. In an emergency situation, it's even that much more stressful. So we want to be certain that we can help provide and maintain what they need in order to do okay. Physical health, behavioral health is tied to physical health. If we can keep them healthy mentally, we're going to be able to keep them healthier physically. And then how should the shelter be organized? Ideally, you have an intake section that's well marked. This is so people dropping off their animals as they're leaving, evacuating, need to know where to go, what to do, have it be easy to find. We also have people who've been animal control officers who've been out in the field doing the rescues, bringing them to the shelter so they know where to go to drop the animals off so they can get the care that they need. Once they've gone through the intake process, then we assign them a housing location. There's often the general population consisting mostly of healthy animals. We will have medical wards set up depending on the needs of the patient. Occasionally you can have an isolation ward depending on the length of time animals are sheltered. We can see disease outbreak of infectious diseases that need to be isolated away from the general population in order to minimize the spread. And in some cases, and the mom and pups really shows that, we get pregnant animals, dogs and cats, or already have litters that are nursing. So we need to have a quiet space for mom and babies as well. And then every animal has information that's kept on it. So we need a place to do the record keeping and data collection, as well as an organized place to store your supplies that are easy to access, easy to inventory, and easy to maintain. So in 2018 at the Camp Fire in Butte County, HSSV, Humane Society of Silicon Valley, was called up for 2 weeks to help with the medical program. We had 2 veterinarians up there through the 2 weeks, and we rotated our medical staff. We had 8 people rotate up through there. And then we also had numerous animal handlers. We had our animal care technicians up to help with the feeding and cleaning. We had a number of volunteers also to help with the feeding and cleaning and enrichment. They rotated through on a cycle of every few days. So to help maintain that. We weren't the leaders of the response, we were the support. On the right is the large stack of crates and crates and crates. Animals coming in, they came in all different ways, but we had access to the crates. If people came to recover their animals and were able to take them home with them, they needed a way to do that as well too. A lot of these people had lost everything, so we were also able to send them home with a crate. Our middle photo is just some of the supplies that we had. Medical supplies and the like. Organized and see-through containers made it super easy to help us see what was going on. And then the picture on the left, we consolidated a shelter at one point. A shelter closed and we went from 5 shelters down to 1 over the course of time. And this is what it looked like when those cats transferred into the main shelter that we were located at. And this is the main shelter that we were located at. It was a condemned hospital, human hospital. The photo on the left shows the intake section just off to the right underneath the tree. The area behind the bright green sign was the main office where daily rounds were held and briefings and debriefings. And behind that, we had cats in one room, dogs in another, and lots of animals in lots of different places. The photo on the right, you can see back in the distance is the hospital. We exceeded our capacity in the terms of numbers of animals we were able to house and ended up calling in for help. UC Davis came and offered some solutions, and we were able to get tents placed. So these are big party tents, and we ended up housing dogs in one of the tents. There were chickens and ducks in the tent right in the foreground. And then the perimeter was surrounded with a fence. The fenced-in area allowed us to then walk the dogs. They had spent days and days in their crates with only minimal potty breaks. This allowed us in a secure environment to walk around the perimeter of the fence on the inside and help maintain their level of engagement and enrichment. Some of the setup that we have to show what it looked like on the inside. There are animals in crates, and some of the times crates were stacked on tables, sometimes crates were stacked on other crates, depending on what space we had and the number of animals that we were trying to house. To help minimize the stress of the animals, each crate is surrounded with, in this case, these are towels and drapes to minimize visual contact from one animal to the next to help decrease their stress. It also helps it's kind of like a mask. We're slowing down the spread of things a little bit that way by having a physical barrier in between the two. Hooked on each of the crates, you can see as a clipboard with a piece of paper. Every animal underwent daily monitoring. Were they eating? Were they urinating? Were they defecating? Were there any signs of disease that needed further exam by the medical staff? On the right, the cleaning station. There's lots of animals, lots of cleaning, and this was outside in the hallway between 2 buildings. The building on the right was the hospital building. The building on the left is a warehouse. And this is the setup that we have for the cats. This was located on the same grounds, just down about half a block in a house, and an older house that was part of the entire setup of the hospital. Cats were crated, top and bottom crates. Cardboard surrounds each of them. You can see on the left, everybody has food, water, a monitoring sheet, bedding, and we were able to, we came in and added some of the enrichment factors that cats really needed. They weren't completely covered in cardboard, or they still had visual access to one another. And so by setting up those barriers certainly helped to reduce their stress in that regard. All the pillowcases that are set up in front of the crates as well too certainly helped to decrease the amount of visual stimulation that the cats had. They had a place to hide. Cats need a place to hide. They didn't have it. This gave them that opportunity. The lower the stress on a cat, the more likely we are to help keep it healthy. And our daily monitoring is being recorded right there. This was the medical setup that we had. One of our technicians is on the left giving eye medication to a patient in the upper respiratory ward. We had an entire room filled with cats that were severely ill. Stress, upper respiratory infections really come into play. And we had a big big push to keep animals in there and to get them out as soon as we could, as soon as they were healthy. On the setup, in the middle, cat's getting its bandage changed. With fire, you get a lot of burn victims. The heat and ash, as the cats are running away, burn their feet, burn their faces, burn their ears. And these can be bandage changes that with time, cats do quite well, but we're looking at daily bandage changes to help deal with the wounds. And then Dr. Kamiya is looking at a chicken. We saw all kinds of things coming in there. There were burns on the feet. We did bandage changes with things there. You can also see that we have at that medical station set up to deal with the most typical things that we saw that in terms that needed medical attention. There's a lot of SSD ointment for burns. There's gauze, there's fluids hanging up that were needed to not only flush irrigate wounds, but also to treat patients as well. And then communication is certainly important when you have this many animals coming into one site. This was pre-pandemic, so people were allowed to go through the shelter looking for their pets. They were escorted. Given the size and scope of this fire disaster as well, in our second week there in December, the National Guard was called, and we had additional really staff to help with everything that the entire shelter operations in terms of feeding, cleaning, as well as enrichment, intake, and helping reunite people. There were a number of lost flyers that came, and people, one of their job was to try and identify animals and match animals up from the lost folder, lost flyers to the animals that were in the shelter. You can see that there's whiteboards with numbers on things there, as well as printouts of daily medical, trying to determine who needs what on a daily basis is challenging to say the least. Once you get the system in place, you're up and running and you're good to go. And then in 2020, we were called up to help with the fire and the evacuation and the shelter again there. We didn't send a medical team, they didn't need that, but they did need the animal care and behavior support. So you just in our big picture with the sunset, smoke and haze, that is a warehouse that they used to shelter dogs. You can see down that it definitely is pandemic time, lots of social distancing and masks. So this was the interior of the warehouse that we just saw. And this was where dogs were housed. It's nice to see, and it's different than we had at the condemned hospital. We have dogs in larger runs. You can see down below that it's a bigger space. They're not crates, but they're actual runs. They can stand up, walk, turn around. There's a space for the food bowl away from the water, away from everything else. They have a space to rest and a bed. So that was definitely an improvement from the setup that we had 2 years prior. And enrichment that we had. Again, National Guard was here as well, helping with the shelter operations. This is one of our volunteers on the left out walking some dogs. Dogs come in together, they get housed together and stay together so they can go out and get some well-needed time outside of a kennel. Enrichment for in-kennel enrichment is something as simple as a Kong filled with peanut butter and a little bit of kibble on the inside. Look through the peanut butter and you get a tasty treat surprise, and various shapes, various sizes for the different size dogs that we had come in. And then this kitty is getting some extra enrichment time outside of her crate. More signs here. This was intake for 2020. To the right, you can see National Guardsmen with the intake tent and signage there saying this is where to go, what to do, making it visible and able for people to see where they needed to go. The signs on the right were the lost dog and cat photos and found cat and dog photos. They were posted up on the outside of animals that came into the shelter so people could look quickly through to help identify the animals that were inside if they were their pets, trying to minimize the amount of people in and out in a closed environment in a pandemic. And then the large animal facility, that's where some of our staff also helped. These are just some of the photos that he had from there. Pheasants, donkeys, goats, llamas, horses, sheep, more goats, and some chickens too. Quite a setup that they had set going there. And really, the more rural the environment, the wider variety of animals you see that need to be evacuated. And this, we have a National Guardsman out walking one of the dogs.
That is so cute.
Yeah.
So I'll open it up for questions. I do want to say I apologize if I didn't give enough time in the last section for questions. So if anybody has a question, please go ahead and put it in the Q&A so we can address it. I actually have a question for you, Jen.
Sure.
So I know that, when people are wondering how they can donate, right? Sometimes people get a little apprehensive about just donating directly to the whole organization. But I know that sometimes people make Amazon wish lists, like different sanctuaries or programs will say, okay, if you want to know exactly what your money is going to, we have a wish list. So if it's like those Kongs or, like litter boxes or whatever, right, then they can go on there and buy the items and then they get shipped to you. How do you recommend people that want to support your guys' program? How do you recommend we do that?
I think the wish lists are great. The local organizations up in Butte County, there was Northern California Dog, I don't remember the acronym, sorry. They had their own website where they were accepting donations and going to local places. You can go to the larger organizations, the ASPCA and the Humane Society of the United States. They're not always involved on site. So trying to find the local shelter or the local groups that are running the shelter, you're going to have more direct impact that way.
That's awesome. So I have a question here. It says, is the center open nowadays?
Humane Society Silicon Valley?
Yeah,
Or
yeah. I'm thinking that.
Okay, we have been open for virtual adoptions for close to a year. We have now started welcoming adopters back on site in the afternoons for cats, so they can meet them and see them in person. And we're still doing some dog adoptions in person, and we're trying to figure out what that's going to look like as we go forward. We're getting much closer as Santa Clara County opens up, so are we.
That's great. Let's see. Someone said it would seem wise for folks to have or carry with them when traveling printed pictures in case of no power or print resource when needed. So I'm assuming this is for your pet. Yeah.
Printed pictures are great. I think the best thing that you can do is microchip your animal. That is a permanent form of identification that every animal that came in was scanned for a microchip multiple times. People were reunited with their pets because of that. And it's also important if your animal is microchipped that the information on your microchip is current. People do move and that needs to be updated.
Yeah, that was a point or an issue for me is you have the chip, you get it done one time and then you never renew it, right? So
yeah,
to follow up with that, you want to make sure. Vicky said, should you have to evacuate and cannot find your animals, what advice do you give for locating them? So when you evacuate and you can't find them.
When you evacuate, you can't find them. I mean, and if you need to go, you need to go. I mean, that is that. Putting signs up, that you can get the sign saying that I have got 2 cats that live in this house and 3 dogs, and those are the decals that go in the windows. So first responders do know who's there, or when animal control is in looking for animals, when it is safe, they do send animal control in to look for sick and injured animals. Going to the local shelters and having a photo, having a flyer, turning in a lost animal report. And that can be done online as well too, in a lot of cases.
Yeah, and I do just want to mention that we within Woodside Fire Protection District, we have had those stickers, that people can put in their windows for, pets and whatnot. The only issue that we've had is that, if people move, or maybe the pet passes away. I know. So I know when I first started working here, we handed them out, but we don't so much anymore. But yeah, it's still, I do still see them. Okay, let's see. Okay, thank you. Here's the link to Humane Society Silicon Valley Amazon wish list. That's great. I'm going to put that in the actual chat room for everybody. Let's give it another minute. And this was something that was mentioned for the last speaker. It says, on the topic of not removing objects that penetrated your animal's body, it would be good to mention never to remove a nail from a horse's foot. I don't know anything about that, but yeah, I could see where that would be a good idea. Just give it a little bit more time. We really appreciate you participating today. I learned a lot, and I really appreciated too all the photos, and then you also showing the difference between what it was like before pre-COVID, right, and post-COVID. So it's really important for people to be aware of the expectations of it.
Yes. Yes.
Hold on, let's see. Okay, I think I'm gonna let this go. Thank you so much.
Okay.
We really appreciate it.
Thank you.
We're gonna move on to our next speakers, possibly Stacy Clater and Fonnie Hill.
Stacy is not going to be speaking. This is Robin Camozzi, San Mateo County Large Animal President. And
yes, that's right. Sorry about that.
That's all right. Yeah. So I can screen share?
Yes, you can. You should be able to.
All right. Thank you. Can you all see that?
Yes.
All right. So as I said, I'm Robin Camozzi, San Mateo County Large Animal Evac President, and Fonnie Hill is on here as well. Fonnie.
Hello, everyone. This is Fonnie.
So we are San Mateo County Large Animal Evac Group. We evacuate large animals in the event of an emergency situation. We have handlers and horse trailers, very qualified people. We've been training for some of us 12 years or more. We're here to lessen the burden in the case of an emergency for the owners, the emergency response teams, and the animals. That's our job. We are up to about 50 team members now. We train throughout the year. We did evacuate a lot of animals in the CZU, and with this presentation, we're going to go through and help and hopefully give you some information and some good insight on how to be prepared and be ready for for a disaster. We're a 501c3 now, so we can take on donations. We're going to go through what you can do to prepare yourself, your animals, your property for an emergency, and how you can make a difference as a private owner or a boarder and help out your other people around you, other animals around you. Why you need to be prepared. Early preparedness is obviously, if you're prepared early, you get out early, you get your animals out safely and efficiently. Sorry, I'm not ready for this today. Ultimately, the responsibility lies on the owner to get the animals out. getting out early, being prepared early, helps you and your animals to get to safety quickly. In the CZU, there was a lot of animals who were not trained to load, people weren't ready to get their animals out. And it takes extra time. As our teams go in, if it's a real emergency, we only have 10 minutes to get the one animal out and into a trailer when we're pressed for time. So we try to encourage people to be ready to get their animals out beforehand. So before you're at that pre-evac is super important to pay attention to. Once the first responders limit access, we're the only teams that can go in and get those animals out. And that, again, makes it a lot harder for us if your animals aren't ready to load, if they're not trained to load, if they're not trained to be handled by other people, if you can't catch them, if they don't, if they don't let you put halters on them, that makes it real difficult. Again, preparing yourself, we're going to go through that. Preparing your animals, your property. If you're asked to evacuate, start immediately. Don't wait. Make a plan. Plan now. Plan at least 2 evacuation routes. We say that because you should have a walk-in and out route. You should have at least 2 ways to get in and out of your property. And a lot of people say, oh, I can only drive out one way. Well, there's always a way to walk out. So try to have those plans. You have a plan A, a plan B, a plan C, and D. Really be prepared with the plan before you need to. And team up with your neighbors, or if you're on a boarding facility, team up with the other boarders and make a plan. Prearrange where to take your animals. In the CZU, a lot of people had prearranged locations, but there were so many fires all over California that those prearranged plans didn't work. So needing other plans, a second and a third plan. And then, of course, we're there to help in the event of an emergency. We set up holding areas. We had 13 holding areas. We ended up opening up Cow Palace. County opened up Cow Palace for us to hold animals because we had so many that didn't have anywhere to go. With large animals, it's very difficult to find a safe place to house them in the event of an emergency. Not everybody has a pasture or an open stall for 12 animals ready to take them on, or a bunch of cattle. So of course, having that plan, but also really getting ready and getting out early. Identification. In the other presentations, there was mention of identification. Chips is always one of the best ways. Having that chip in your horse's ideal, or whatever type of animal, your llamas, you can put them in any animal. But pictures are also very good. And then you can put use ID, the stock crayons, and write on their hip. You can write on their hip, you can braid something into their mane, you can put something on their halter, you can write on their hooves with permanent marker, but those chips really do help. And immunizing. A lot of people say, I don't immunize because my horse doesn't go anywhere, or my animals don't ever leave, or nobody ever comes on. But in the event of an emergency and a disaster, animals are taken and put it all together or near other animals that they've never been around. And so immunizing is really important in that when they all get together, we don't have a spread of a lot of diseases if we have more animals immunized. So we really encourage people to immunize their animals. Grab and go. Keep a grab and go kit, documentation on feed, health issues, and medications with each animal. You'll say that's what we usually have. People who put a little emergency box by their stalls, or maybe on their ranch at their barn, where it has all the documentations of the animals that are there, with a picture and a list of their special needs. Are they difficult to handle? Do they need to live by themselves? Things like that. And then contacts, 2 offsite contacts, 1 local and 1 out of the area. When phones don't work, you want somebody that is out of the area and out of the fray of all the what's going on, and can, of course, remaining calm. If you're calm, it helps your animals. It helps your animals a lot if you remain calm. And train them before an emergency. Take them out at night, take them out in bad weather, in crowds. Let other people handle them. Have headlamps, glow sticks. Just really train. Use flashlights. Use just a lead rope around their neck and lead them like that. Take them through gates, back them through gates, load them in different types of trailers. You never know what kind of trailer they're going to need it to load in. If you don't have them, see if somebody you can borrow one, or maybe have a clinic where you do trailer loading with your animals. And we're not just talking horses. We had llamas, we had a camel, we had a 400-pound pig, a lot of animals. We had a lot of donkeys that we moved, and none of them had ever been moved before. So really try to get your animals used to moving. And if you don't have a trailer, you can put down a piece of plywood on the ground. You can make a ramp up to it. You can load them on that piece of plywood. It makes a similar sound. It just helps you and them to sort of place them in an area that's a similar size of the width of a trailer, just helping you to gauge how to move them forward and back, and how that would feel being in an area that is that small.
Robin, I'd like to just jump in
Sure.
for a second here on, you're talking about getting your animals prepared, and
Yes.
we were one of the evacuation teams, and we had one blind horse that had to travel with its companion pony, but that owner had trained that horse to load in a trailer, how to back out. And when we picked them up, they didn't know us, they didn't know our trailer. And the horse just did a beautiful job, just staying calm, talking to it. So if someone can teach their blind horse how to load in a trailer and back out, anyone can.
Yep. Good, Bonnie. Yes. It just takes time and practice, start early again. We're early in the season, and we don't have to just worry about fires. There's flood, there's other things we have to worry about to be prepared. If in the last one where there was the windstorm that was supposed to happen, the big windstorm, we were on alert, but we were told that at a certain point, when the wind hit a certain level, speed, we were not going to be allowed to go out, because it was dangerous to go out with the trailers in high winds. So again, really planning ahead. It's, I have a trailer, it's windy, it's okay, I don't need to worry about it, but really thinking ahead that way. Okay, in your go kit, have your plan written out. If someone must evacuate, they need to know what if you have to leave and we come into your ranch, if you have a list of all the animals there somewhere where we can see it, or there's an emergency box that we go to and we can find it, we know maybe there's a little stall off to the side where there's an animal, a little pony in there that nobody can see over, or nobody can see that area. Make sure that it's written out so people can find those animals. The quicker we can get in there and get them, the better. And permission slips from your neighbors or emergency responders. We have an animal ID form on our website. They're all over the place, but on there you can sign the back that yes, in the event of an emergency, please take my animal. Please don't leave my animal if at all possible. So make sure that there's some kind of permission that allows people, so that if you're not home, because we're not just going to go in and start taking animals off of people's properties. And your contact information, your primary and secondary. Again, we talk about microchips, photographing, markings, proof of ownership, and animal special needs, the feeds, real important for some of those elders, or if they have medications that they need, and their behavior, so that if they need to be with that, let's say there's a horse, an old horse, that old horse need to be with another animal, he needs to be with another horse so that he wasn't scared in his stall. We had one horse that we had evacuated, and he had a little pony that was on the ranch with him. We didn't know why he wasn't eating, and he just wasn't eating, and we kept talking to the vet, and the owner was evacuating, so she hadn't been around for 3 or 4 days, and we finally got in contact with her and said, look, your horse isn't eating, we're really worried. Well, where's his pony? Oh, his pony's in the stall, he can't see him. Well, once we put the pony where he could see him, that horse started eating and was fine, and everything went well for him. But we had no idea that they belonged together. They didn't scream for each other, they didn't act up or anything. He just didn't eat, he just was sad. So just a real good thing to have, that maybe you're the only one that knows that, but if you're not there, we need to have that information somewhere so others know that. Your escape routes, again, were secondary escape routes from paddock, stalls, and property. We've been to barns lately. We go and look at barns and help assess the barns for safety and preparedness. A lot of barns have only one gate, one door in and one door out. There's not a back gate. There's not a back door. Well, if that barn's on fire or it's flooded or something's going on, electrical wire down, you need another door to get out. You know, it's not always ideal, but it sure is helpful if you have a second gate or a second door out the back. So try to look at those. And then, of course, are they secure? And remember that, you know, if you have wooden gates, they burn, metals gets hot, and PVC melts. So you're not going to change that. Just be aware of it so that if you are waiting too long, you know, you have to remember that those things will happen when you go to touch them. So, and then extension cords ignite, cobwebs, make sure you're cleaning your barns for the cobwebs and your outlets. Having refrigerators in your barn, make sure that you clean the backs of them, and checking that your gates swing both ways. Big thing with gates, we all have that gate where the latch doesn't work real well. It's, you know, kind of squeaky, or you have to pull on it, or maybe it doesn't open both ways, and you're trying to pull it in toward you, and you're trying to get your horse that's a little excited out. And it's okay in a day or daily event, but when you're in emergency, that takes time, and you can get hurt, you can get squished. It's not always ideal to have gates that open both ways. And then Fawny had something with gates. Fawny, you want to tell a story about what happened with the gates that you were dealing with?
Yes, we were deployed to pick up, evacuate 4 horses, and there was a gate to the property which had an electric pad, but the electricity had been shut down. So we had to go to extraordinary means and take the gate apart and take the gate off. And it was a big, heavy metal gate, but it was the only way we could get in to rescue the animals. So we have bolt cutters, we have crowbars, and worst comes to worst, we'll ram it. So we go in if we're deployed to go rescue an animal.
Yes. Yeah. So really making sure that you, and if you're calling for somebody to pick up your animals in the event of an emergency, make sure that they know, hey, I have an electric gate, and it's, you know, the electricity's out here, so be prepared. Bring something that you can open it with, because maybe I don't have it, or I'm trying to gather everything together. So again, that's part of your plan, really making sure that your plan covers all those aspects of how to get in and out of your property, and how to let others know how to get in and out of your property when you're not there. Big thing, when you're not there, because when we go on, we've never seen your property. So when we go on, we're looking for the animals, and we're looking to get in, and we're looking to get out as efficiently and quickly as we can. Your equipment, your halters, your lead ropes, your leashes, whatever type of animal you have. If you have that one that when you go to pull that hook and it's jacked and it's just stuck and you can't get in, or maybe the little thing's rusty, it's time to get rid of it. It's time to turn it in. Maybe it has your horse's name or its little nickname on it, but you need to hang that up and get a new one, because that every second, every minute, they all add to more minutes and more time that you take to get out and get ready, and also stress out in trying to do all these things. So make sure all your equipment works really well for you and for those that come to get your animals. And make sure your trailers are in good working order. If you don't use them, don't park them where they block the gate. Don't park them where they block other trailers, or where there's a turnaround for trailers that are coming in to have access. So really watching where your trailers are, and also making sure that you're keeping them in good working order. And again, you can you're being prepared. Be an aware owner. Plan your escape routes ahead of time. Evacuate early if you can. Ahead of time. Can't stress that enough. Boy, those animals that we worked with over and over, Fawny, and can tell you a little story. I can tell you a story for Stacy. Stacy had not been part of our team early on, and we went and did a presentation to her, and she got her animals pretty well trained up to get ready. She had a plan. She knew everything. She called me during the CZU. She's part of our team, yet she needed to evacuate. So they told her she had 3 hours to evacuate. And she called me. She said, I got to move 26 horses and 8 head of cattle. and I need room. I said, okay, tell me what you got and who goes where. So Stacy had marked all her animals on their hips. I told her what stalls. Hey, these seven are going to be in section A. Please number them A1 through 7. Section B is going to have 3. So she went through and she marked on their hip every section which number that horse was, so that when they got to the ranch where we were putting them, they pulled out of the trailer, and whether they were mixed up or not, we knew what section they were going into and who could go together. So she had a real plan. The paperwork came with the trailers. She also had trailers, but she didn't have enough, so we said more. I think Fawny was one of those trailers that went and picked them up.
Yes.
And those animals it was a smooth transition for them. We had everything set up and ready to house them in no time because she had a plan. So plans really do work. Those 26 animals were moved, and that 3 hours turned in an hour and a half. They were really pushing her with a helicopter over the property to get out. And we were able to do it. We were able to get them out of there and get them out safely. So having that plan and being prepared ahead of time and staying calm always helps. Inspecting your surroundings and your equipment and doing regular maintenance. In the event of emergency, stay calm, look around, check what's going on, and make sure before you even make any moves, just look at the surroundings. Just heads up, make sure there's no wires down, make sure that all the animals are ready to go. Halters are there, things are ready, trailers are parked so that you can get in and out quickly. And keep that go kit. We talk about a go kit. A go kit is what you think you need. Nobody can tell you what you need. Earlier they were talking about US thermometers and clippers, and we have ham radios in ours. We have bandages. We have our first aid kits. We have extra clothing for ourselves. We have extra halters. We have, a lot of people throw feed in. But in the event of an emergency, grabbing a little bit of feed is good. But usually what we're finding is once you get to your holding area, there's feed there for those animals. So really take the time to get ahead of time to have your go kit, have the medications you need, have the information you need. Have those things. Those are the important things. And keep your family and friends and facilities up to date on everything. Keep all that information up to date at all times, and practice your plan, and practice it a lot.
I would just like to add in practice your plan. There was one situation where we were called in to evacuate 2 horses that were rarely haltered, never trailered. And we had the time, but we spent an hour and a half on one horse. If it had been an emergency, we would have had to leave that horse. Mm-hmm. And that's something we don't ever want to have to do. We don't administer any sedations or calming medications. We're not allowed, but the owner can do that if there is a problem on site. So as owners, if you have a horse that is, or an animal that may not load well, has a lot of anxiety, you might want to keep some calming medications on site because we cannot administer them. We would have to have left that horse behind if the owner hadn't administered some sedatives.
Yes. Yeah. And we went to many like that. We did have to leave a few. There were 6 horses we had to leave that were, they turned them out in a 40-acre pasture, and then called us, and there was no way to get them. There was just no way. They were already horses that had very little handling. But then to turn them out in a 40-acre pasture, which ended up being safe for them because the fire didn't make it that all the way to them, but it was headed their way, so it could have gone either way for them. But again, yeah, like Fonny said, in that situation, we can go with a stock trailer and load them up if there's an area that we can work with. But we would have to leave them if time was pressing and the fire was coming. So be your own emergency response team. Bert's here to remind you about that job. Early preparation leads to early evacuation, which leads to early recovery. The calmer you are, the more prepared you are, the calmer your animal is, and the easier it is for your animal to relocate to a new area in the event of a disaster. If they arrive calmly, you arrive calmly, it's just so much easier on them. The animals that where you could really tell in the CZU, the animals that people had prepared to ahead of time. They trained them, they loaded, they tied, they used to being with other people handling them. It made a difference. Those horses arrived, they were calm, they went into stalls easily, they were at the cow palace, they were at different barns. Some of them moved a couple miles from their house and then they had to move again. There was one set that moved 4 times. But they loaded and unloaded each time, and you know, that was kudos to the owner for doing all the work ahead of time. So, and then you know, we like I said, we have stuff on our site, as well as I don't know if you guys can see this. There's some really good information on the halter project. Can you see the screen here with the halter project?
No, I don't see anything.
Let me see if I can put that up.
No, we can't see it, Robin.
Okay, let me share it. This group here has a lot of good information. We've done some trainings with them. We're going to go do some more. They have a lot of good information on how to prepare. They help out all over, and they have a lot of good trainings as well. So another good group. And on our site, we have a lot of information as well. And that's all I have for you.
You might want to mention the website, Robin.
Yep, we had it in front.
Yeah, I had a couple of people that were asking about contact information for you guys. What is the process, maybe, I guess, for how you guys get deployed or activating the large animal evac?
So to activate large animal evac, we're only activated by Office of Emergency Services. We do not self-deploy. We do not self-activate. So it has to go through the chain of command. Always. You can find us on this. There's our website and an email to contact us. But yeah, we.
So what I'm thinking is if, you know, if we had a fire in Woodside Fire District and, you know, people were evacuating, would you guys then be deployed by OES just to find places that had large animals, or how does that work?
So how that works, we don't go, again, we don't go driving around. So calls start coming in right away. So 911 calls come in for large animal help, and they're immediately sent to us right away. We're dispatched and we start receiving those phone calls. And what happens is like 911 gets the information and calls us. And gives us the information. So then we contact the owner and we right away send somebody ahead. Okay, we've got, you know, truck and trailer coming your way. What do you have? How many animals? What size? Where? You know, basically get all the information and deploy our people out.
That's great. Yeah, you just said, could just fill in the word people for large animals. It's so true. You know, all this stuff, I feel like it's the same when I'm or any of my colleagues are teaching about preparedness, you know, and planning and doing it ahead of time and having a go kit and, you know, having paperwork and medication. You know, it's extremely important to have that in advance.
Yes.
Let's see, I'm going to look back. Somebody asked a little bit earlier, what are the minimum immunizations for solo horses? Does anybody have an answer for that?
So for myself, I would say that, you know, is a recommended rabies right now because San Mateo County has rabies in San Mateo County. There's been cases in San Mateo County, as well as strangles, rhino flu, and Eastern Western, and then tetanus.
That's great. Thank you.
Mm-hmm.
Let's see if there's any more questions. Oh, there was a question in here. It's kind of CERT specific. And maybe if, you know, and this is for the other speakers as well, but it just says, as a CERT volunteer, what can or should we do if we find an animal Is there a centralized place to take animals, or do we as individuals take the animal to the Humane Society? In other words, is there anything as part of the CERT group that we can do to keep the animals within the area where they lived, or is this too much to do in time of a disaster? Oh, I think.
So keeping them, sheltering in place for large animals were sheltered in place in the CZU if it was safe for them to stay, or if they just couldn't be evacuated. So for us, it goes on a case-by-case basis. If when CERT people were called out to areas where a large animal needed to be moved, most CERT people didn't have the means to evacuate those animals, so then we were called out. But we did shelter in place animals as well, and we went out daily and fed and watered them and took care of them.
For small animals, the fires last summer, CAL FIRE posted where animals were being housed, and it's important to go to where the locations are centralized, so people that are lost animals know where to go and look as well.
Yeah.
So I would assume then it would be important then to convey the information to our CERT teams. So our CERT group, you know, we wouldn't be necessarily in charge of handling the animals, but just keeping information so that we could reunite the people to their pets if they were sheltering in place or if they were taken to a shelter somewhere else.
Yeah.
I do want to mention too, I have an app on my phone. It's from the Red Cross, but it's for pet first aid, and it's pretty awesome. You know, right when you open it up, you can go dog, cat. So obviously for small animals, but on it, they have a hotel locator, it's preventative care, well-being, spaying, neutering, lost cats, how to travel, giving meds. So all this stuff on there, and it's just an app on my phone. So I do recommend that app if anybody out there wants something that they could just put on their phone that they can just access. I do also want to say that if you do have a small pet and you know, you're building your plan to make sure that when you're planning for evacuation, if your evacuation plan includes going somewhere like for a hotel, you make sure that that hotel is able to accommodate animals. As well, be aware that many shelters, if you do have to evacuate to a shelter, they're not going to allow pets most of the time. So make sure you have a carrier for your pet. It's, you know, same information all the way around, but just make sure that you do this stuff in advance. So the name for the Red Cross app is, as all it shows on mine is Pet First Aid. So I think I searched Pet First Aid and it came up Pet First Aid Red Cross. And it's a great app. I really, really like it. I think it also teaches you how to do the Heimlich on your pet, or how to help with choking, because we can't use that word. It's let's see, I think there's another question. It says, how can we as pet owners get microchip data changed? We adopted a feral near our house and moved. Who should we contact to see if the chip data can be changed? Would Santa Clara County Humane Society have that information?
Your vet can read if your vet has a chip reader, they can get the number of the chip, and then you search where the chip is from, what company, and then you contact them, is what I believe. Somebody else might have some other information, but
I think that's right, because I think when I brought my cat in and she had a chip and it was a rescue, she just scanned it, and I was able to get the information transferred over, because it does, that tells you who the owner of the chip is. I mean, the company, so then you can just go on there and then reassign it.
Mm-hmm.
Let's see. Any more questions? I'll let it stay open. I think you guys have done a great job so far. I thought this was great, covering not just, dogs, cats, small animals, but large ones, and not just horses, but llamas, right? Goats, sheep. We have it all here. All right, I don't see anything else popping in to our chat box. Let me just see. Yeah, I think I want to say again, I really appreciate all you guys coming on here. And I think what we're going to be doing is requesting your guys' PowerPoints so that we could pull some of that really great information that you gave us so that we could reiterate it to a lot of our residents here. I think it's really, really good. It just kind of extends our message of being prepared. And I know it made me a little bit more confident in some of the information I'll be providing to my residents here. So thank you so much. Also, if anybody wants to follow up and have additional questions that maybe they think of later on, you can always get in contact with us through our WPV-CERT or WPV Ready websites. As well, too, we will be posting this video on our WPV Ready and WPV CERT website or YouTube channel. So thanks so much for coming on here. Oh, we're posting on our WPV Ready. Thank you. Mark's putting it in the chat box, so if you guys want to check it out. Aside from that, we really appreciate your guys' time today, and we hope to see you at our next training, which is next month. The topic for next month's training will be, I believe it'll be based on first aid, so bandaging, bleeding, how to put on and take off gloves. So we hope to see you there. Thanks so much, everybody.
Thank you, Selena, for putting this together, and Vicki Coe.
Yes, a special thanks to Vicki for getting all you guys to present to us. We really, really appreciate it.
Thank
And
you.
what great resources we have in our county for sure.
Thanks to all of you for being willing to do this. It was wonderful.
Thank you. Thank you.